This is Dr. Williams. Today I wanted to talk to you about pain after cesarean section, and very specific pain. We would expect that most patients, after having a C-section for childbirth, would do very well, and almost all of them do. But there is an occasional patient that has pain that radiates into the surgical scar and goes out toward the outside of the hip, lower abdomen, in the groin, and it persists. What do I mean by persist? I mean that if it doesn't go away after 6 to 8 weeks, that's when I start to get a little nervous that several nerves may be stuck in the cesarean section scar. Those nerves are called the ilioinguinal and iliohypogastric nerve. They go to the groin, they go to the pubic mound, but they don't go to the actual genitals. And so patients complain of burning pain or searing pain into the groin region. And so here, this is the distribution that pain will radiate to. Again, it doesn't go to the actual genitals themselves, but it does go to the groin. The reason why this can happen, some cesarean sections are done as an emergency or urgently, and so there can be a fair amount of bleeding. It's a chaotic time in the birthing unit. People want to get the baby out safely. They want the mother to be safe as well, but some of these can be very traumatic events. And once the baby is delivered from the abdomen, it has to be repaired. And so the surgeon is trying to close the abdominal wall. And if there's a fair amount of discomfort, a fair amount of blood and chaos and things of that nature, they may just be taking stitches to close the abdominal wall. And even in the best of circumstances, no fault of the physician, these nerves may be in the exact location that they need to put their stitches. And so occasionally, once in a blue moon, these nerves can get stuck within the suture. And because it's tied down, the nerve is stuck. Or the nerve may get stuck in scar tissue. So what happens if that occurs? Most people will get better. They may have pain or discomfort that lasts for a couple weeks. They twist and turn. They feel electricity or jolting sensation or burning or hypersensitivity. The pubic mound may feel like it's on fire, like you have a road rash or a bad razor burn that never goes away. And if that happens, what we would recommend is that you would consider having some nerve blocks performed, which are done with a needle and some local anesthesia, where they put the nerve to sleep right next to the hip bone. And what should happen if they put the ilioinguinal and iliohypogastric nerve to sleep is that the pain that radiates into that groin should go away almost instantly, but certainly within a few minutes, as that local anesthesia puts the nerve to sleep. If that works, then you have a diagnosis of what's causing the discomfort. Now, fortunately, most of these patients do get better with time, but there are some medications that can be given, like gabapentin or Lyrica or Cymbalta. Some of them have some side effects, but it may take the pain level down. It may even cure it. You can try topical creams. You can try scar massage, physical therapy. Water therapy is wonderful for this, sitting in a bathtub or a swimming pool, or using shower water against this area to desensitize it from hypersensitivity. But if it doesn't start going away after 3 to 4 months, then we start to get a little worried. We typically get involved as a peripheral nerve surgeon at about 6 months. Sometimes sooner, oftentimes much later, because unfortunately it's not well understood. Because it doesn't happen very often to one particular surgeon, they may not be really attuned to what to do for this. They may send you to a pain management team who tries a bunch of medications, which is perfectly reasonable to do. But if that does not work, or if your pain is still continuing, then that's when the nerve blocks are very helpful to make a diagnosis. And over time, if that does not go away, but the nerve blocks help, the pain comes back, the nerve block helps, the pain comes back, the nerve block helps. We typically take the approach of removing these nerves. Can you live without these nerves? Yes, you can absolutely live without these nerves. They're small branches, but they carry a big punch because they're in an area that moves a lot. They're in an area that can be involved with intimacy, and it's quite uncomfortable. But because they do not go to the genitals themselves, these nerves are expendable. And most people would rather live without sensation than have pain. And so the best way to know what that would feel like is to have a nerve block and to see what you feel like. These nerve endings are small. We do tuck them into a piece of muscle in the abdominal wall. And we would expect that most patients should be able to return to their normal daily activities. There are some restrictions, of course. We would not want you to be in any heavy environment that's causing a punch or a kick to this region after the nerves are removed. And you may have to be careful with children jumping into your lap for a little while. But intimacy and other activities, jogging, exercising, all we would expect patients to be able to get back to doing again eventually, usually within a few weeks to months after surgery. Other options that people can use for this may include medication management. There are some stimulator devices that can be used, but as a surgeon, we tend to try to go to the source of the problem and fix it and remove it. But there are pain management teams that can use stimulators. We tend to reserve those for people who fail the nerve resection procedures, but other people have different opinions. If you would like to talk with us at all about this pain that you may be having after a cesarean section, or any abdominal incision that goes into the groin for that matter, we're certainly happy to do so. Contact our office and we'll be happy to set up an appointment for you to do that. Thank you.